I was fortunate to be selected for one of the Faculty Excellence Awards on a research project that we conducted within our physical therapy department. And so my goal is to share the findings of those results today and hopefully have some questions you have some questions that I'm able to answer, even if it's not related to this study, but even just maybe physical therapy in general. So I'll go ahead and get started. The title of my project or presentation this morning is Picture Perfect, Unveiling Physical Therapist Perspectives on Diagnostic Imaging Referral in the State of North Dakota. And I'll give some background as far as how we came to this study and really the implications of this study moving forward. I have to give credit to where credit is due. I didn't do this alone, this research project. I have to thank my colleagues. So Dr. Jason Hogan, who is also a faculty member at the University of Mary in our PT program, he was impactful on this project and helped assist primarily in the qualitative perspective of this research. And then the four individuals to the right here, they were students of our program, third-year students who have recently now graduated, now have a doctor in front of their name that are out currently practicing. So Kendra Karl, Mattias Stich, Christopher Dean, and Sara Lawson also helped with this project. So I gotta make sure I give credit to those individuals. So a little bit about me. I just wanted to share some information or background information about me. I am an alumnus of the University of Mary. I graduated or came here in 2010 for my undergraduate degree. Had many classes in here. In fact, I think my psychology courses, abnormal psychology, I'm trying to think of some other courses, but yeah, I spent a lot of time here. And then I was in the PT program, graduated in 2016. After that, I had on my mind to pursue some post-professional training in the world of musculoskeletal orthopedic practice. And so I attained my manual therapy certification in 2018. Basically, that's advanced skills in manual therapy, joint mobilization, manipulation, adjustments, as we also call it. So I spent some time there, became a board-certified orthopedic clinical specialist in the world of the American Physical Therapy Association. And then I went on to become a fellow of the American Academy of Orthopedic Manual Physical Therapy in 2021, which is kind of further advanced training in manual therapy, including joint manipulation, mobilization. I was a student, and I just finished being a student as of December. And I think at this point I am officially done. My wife basically gave me an ultimatum and said, you have to be done with school, and I am officially done with school. In December of 2024, I got my Doctor of Science, basically all the stats courses and being good at research, which has obviously helped me with this. Additionally, I practice PRN part-time outside of my teaching obligations here at CC's Physical Therapy. Maybe some of you have heard of CC's Physical Therapy in town. And I spend some time practicing and treating patients, which has definitely helped me in my role as a professor. I met my wife here at the University of Mary. She's an occupational therapist. It was one of the assignments we had. We had to go to the nursing home, and we locked eyes, and it was history ever since. And so the assignments, I joke, some of the assignments our students do in class and throughout the curriculum, you might meet your spouse through some of those. So this is Grand Teton National Park before kids, where we got to spend a lot more time traveling. And so that is us a couple years ago. As I mentioned, I am a professor in our physical therapy department. I'm very fortunate to be where I'm at. I love the people I work with, and I'm blessed with the best. This is our most recent graduated class this past spring of 2024. We have our annual graduation picture in front of the Welder Library. As I mentioned, I primarily teach our musculoskeletal orthopedic content, assist with research, assist on our admissions team as well. And as I mentioned, I also practice. They let me come in whenever I am able to and treat some patients. My area of specialty is primarily neck pain, low back pain, headaches, TMJ, things like that. So I love treating those conditions. And then I'm blessed with two amazing sons. So I have to share a story. Um, when you become a parent, I feel like you just like roll with the punches. You just try to figure everything else out. So this is Cohen. He is 2 years old. We absolutely adore him. And this morning, I was driving to daycare, and I knock on the door, and I hand him off, and our daycare provider looks at me, and she's like, "We're closed today, Matt." And I'm like, "Okay." So he is out here with us today, and he's playing trains with one of my colleagues right now, and so you just make it work. I maybe could have brought him here, but that would have been a little bit more challenging, so I decided not to do that. So that is Cohen, and then this is Noah. He's our 4-year-old, and again, very blessed. So before I started, I wanted to put up a QR code. I wanted to just kind of get us engaged a little bit and hear what your thoughts are, and so I just have a couple questions I'd like to ask the audience here, and then we'll kind of get started into the talk. When you think of a physical therapist, what really comes to mind? I'm just starting first here with just your thoughts about when you think of physical therapy or physical therapist, what comes to mind? This is a word cloud, so the larger the word, the more likely more individuals are filling that word out as well. Rehabilitation, which is absolutely exactly what physical therapists do. Sports athlete, I think that's a very common one. Gross motor skills, daily activities, muscles. Well, perfect. You guys have a good understanding of the basics and foundation of what we do as physical therapists, which is fantastic. Next question, what area or practice of physical therapy are you aware of? Many people think of, and I'm gonna guess, I won't give it away, but I have a feeling there's gonna be one that's gonna populate more than others. But when you think of a practice setting of physical therapy, what do you think of when it comes to physical therapy? So orthopedics, definitely, I think, is one of the most common areas of physical therapy. Sports, as I guessed, is also up there. We think a lot about orthopedic and sports. But really great, there's a lot of variety here that I'm seeing, which is fantastic. Women's health, pelvic health is a very great area of physical therapy that I think is underused in our society, and in fact, is, I think, gaining widespread popularity amongst the public. Private practice, acute, absolutely acute in the hospital, in the ICU, those are areas where physical therapists can treat. Pediatrics is another area that is very common. Some areas that are not up here, well, I see geriatrics. That is a very common area that physical therapists can practice as well. In the skilled nursing facility, working with those individuals, aging adults. Some areas of physical therapy that I don't see up here that many people aren't aware of. Oncology, so you can have an oncology specialist in physical therapy. Another area is wound care. So a lot of physical therapists have training to provide wound care, and you see this a lot in a rural setting where you wear many of these hats. But wound care, sharps debridement, all that fun stuff. Physical therapists in the room, what else am I missing? Ortho, sports, women's health, oncology, pediatrics, neurology, right? Neurology is a big one, so post-CVA, stroke, traumatic brain injury, spinal cord injury, so you'll see those individuals as well. So you see a lot of variety of areas that physical therapists can practice, which I think is why many students find it very attractive, because even within the world of physical therapy in your license, you have the capability of kind of switching careers if you wanted to, just within your license itself. Okay, I just have, I'm kind of going out of order. We'll see if this works. True or false, physical therapists are able to refer for diagnostic imaging in the state of North Dakota. Diagnostic imaging including plain film radiographs, MRIs, CT scans, things like that. The answer is true, and we'll talk about that a little bit more. Last one. Physical therapists are able to see patients without a referral from another provider. So an example would be, I can go see my physical therapist directly without having to maybe go to my primary care physician first and then come and see a physical therapist. So true or false, physical therapists are able to see patients right away, patients can come see physical therapy right away without a medical provider's referral. And you are correct. The answer is true. So we call that direct access, and I'll speak to that a little bit more. Diving back in the world of diagnostic imaging, just to give you a little bit of historical background, physical therapists have been able to refer for imaging, at least in the military, for the past 50 years. So in the military, a lot of physical therapists have the capability to kind of do whatever they want to do, or have a little bit more additional scope of practice. Definitely, imaging referral is part of PT practice. In fact, you're seeing, as of 2016, all accredited licensed physical therapy programs have to teach curriculum related to imaging. Physiotherapists, that's the name of physical therapists outside of the United States. I think that name is a little cooler, actually. I think we should move to be called physiotherapists. But physiotherapists in other countries can also refer for imaging depending on the country they live in. And physical therapists definitely use evidence-based practices as far as when to order imaging, and that's what we teach our students in the curriculum. So this is a map of the United States, obviously, and you can see here currently, as of today, what physical therapists are able to do when it comes to referring for diagnostic imaging. So I'm going to break this down for you. The red, bad. In their scope of practice, it specifically prohibits physical therapists from referring for imaging. So there's definitely going to be some advocacy and work on our end as physical therapists to try to get these states to at least allow for that. The gray basically means silence. There's nothing in our scope of practice. Each state has their own scope of practice that allows or dictates what physical therapists can and cannot do. Gray basically means there's nothing in their scope of practice that says you can or cannot. The dark green means that those states can refer for imaging and includes all imaging. So plain film radiographs or x-rays, diagnostic ultrasound, MRIs, CT scans being the most common. The light green that you can see North Dakota, Wisconsin, and Rhode Island are with, this is only specific to plain film radiographs. So in their legislation, only x-rays, physical therapists are able to refer for that. And then the yellow, complicated, I won't dive into that. The green dots basically mean that hopefully within the next 6 months, we're gonna see those states green. So you can see that this is definitely a growing trend in the world of physical therapy. If you had to guess out of these states, which state do you think was the first state to allow for diagnostic imaging referral for physical therapists? Just, if you're brave enough, just throw out a state. You are correct. Wisconsin was the first state in 2016. I did not plant that. That was a good guess. So as I mentioned, North Dakota passed this in August 1st of 2021. This is our APTA North Dakota president, Cindy Flam-Mellon. This is also one of our faculty members, Dr. Catherine Stalick. We pushed for this. We got it passed, again, specific for plain film radiographs in the state of North Dakota. Currently in North Dakota, though, we're in a legislative session, if you haven't heard, and we also proposed the Senate Bill 2273 that has passed the small subcommittee and has also passed the Senate, is now in the House being voted on for physical therapists for North Dakota to turn dark green. Right, we were a light green, only able to refer for x-rays, but now we're trying to perform, physical therapists, we want to be able to refer for all imaging, including MRIs and CT scans, and I'll talk more about that later. So we'll see, hopefully, in the next couple months, that be passed, and we had no opposition, and hopefully that will be some good news moving forward. So I wanted to dive a little bit about the evidence regarding physical therapists and diagnostic imaging. Well, I only have 50 minutes, and so I can't go through pretty much all the research out there, but I just wanted to show you, this definitely has been studied within the past several years as far as imaging within the curricular setting, imaging in clinical settings, comparing us to other healthcare providers and primary care providers. And when we say primary care providers, we talk about your medical doctors, your physician assistants, your nurse practitioners, other areas of practice that you can go and see. So this definitely has been studied extensively over even the past 5 years. But there are a couple studies that I want to highlight with you today. So this was a survey done by Dr. Sean Rundell, who basically surveyed a bunch of physical therapists around the country. And what they found is about 12% of physical therapists are referring for diagnostic imaging. Now, also to note, they surveyed individuals who didn't necessarily have the jurisdictional scope of practice or the ability to refer for imaging because their state maybe was gray or red. So obviously they wouldn't be able to refer for imaging because the state is saying that they cannot do that, and they most likely want to keep their license. But attitudes differ depending on the professional development following PT school. So in the world of physical therapy, once you graduate, you can go on, just like medical school, you can go on and become more advanced and specialize in certain areas of practice. And so what they found, basically, to summarize this last bullet point, depending on the years of graduation and the amount of post-professional training, that definitely dictated whether they were using imaging or not. And in fact, if you had more post-professional training, you were more likely to refer for imaging or have that skill. Also, again, another study by Dr. Mabry here in 2022 found that having training in DPT school, so fun fact, physical therapist as of 2016, all accredited programs in the United States is now a doctorate degree. It's mandated. However, many programs move towards a doctorate much further. And in fact, when did University of Mary move to a doctorate? 2006. So we've seen that transition happen, but by 2016, every program had to move to a doctorate. So having that training in DPT school, post-professional training, as I just mentioned, and then being a member of our organization, the American Physical Therapy Association, showed that those individuals, those physical therapists, were practicing and using imaging more regularly and living to their scope of practice. From a curricular standpoint, I teach this content in the program. There's been some studies in 2014 and then most recently updated in 2024 here that obviously it's varied across curriculums in DPT schools. The average is about 28 hours of content related to this. So we are teaching our students this content and hopefully getting them comfortable and able to use this moving forward. So why are we here today? Well, we were able to get this study published in a peer-reviewed journal through the Journal of Manual Manipulative Therapy back in spring of 2024, so about a year ago. And so I hope to dissect the study in which we really wanted to identify specifically to North Dakota, physical therapists practicing in the state of North Dakota, their attitudes, beliefs, and really why they may or may not be directly referring for diagnostic imaging, because especially as of 2021, they've been able to do that specific to plain film radiographs. Again, how we came to the study. So as I mentioned, I practice part-time at CC's Physical Therapy outside of my full-time obligations here at Mary. And it's very common that you get a patient that comes in, right? We have direct access. So about 90% of the patients that I see at CC's Physical Therapy, and I think even as a clinic, and I would say this is very common amongst different private practices in town and around the country, are direct access. So what that means is these patients are coming in and seeing physical therapists without seeing a medical doctor first. We are their first contact provider. So the transition of the doctorate allowed us to make sure that we know and are able to screen them effectively, as hopefully all of you want from your provider when you go in and see someone, that you are there for the right reasons, that you don't need further advanced imaging, blood work, anything like that, right? So I'll give you an example. I had a patient who came in who had sprained their ankle. They were playing pickup basketball, sprained their ankle, right? A very common injury that we see a lot. As they walked into the clinic, right, they were kind of doing this with crutches. And so immediately we have some evidence-based guidelines that physical therapists and medical providers can use, and determined that this patient likely had fractured their ankle, or at least we wanted to rule out that they had fractured their ankle. And so historically, physical therapists were unable to make that referral. So the process was we had to call their primary care provider, which maybe took on average about 1 to 2 weeks, get them in, and then get an image. Depending on whether an x-ray was needed or an MRI, that probably took another 1 week or 2 weeks to find out. And then by the time we got those results back and they came back, money, seeing a different provider, almost 3 to 4 weeks on average to find out whether they had fractured their ankle. You can see kind of the problem that faced. Another good example of this is probably about 6 months into my practice, I had a patient come in with nagging hip pain. She was about 65 years old, and so going through my exam, we asked all the questions, all the screening questions, and she passed all with flying colors. But about a month in or 2 months in, she wasn't seeing any progress, was not seeing any improvement. And at that point, I started to get a little bit nervous as her physical therapist. And so I talked to her that I think it would be worthwhile to get some imaging just to make sure that everything was okay. But again, the steps were I had to call primary care physician, get an MRI. That probably took about a month between when we made that call and when she got in for imaging. And unfortunately, we identified that she had stage 4 pancreatic cancer. And she ended up passing away a couple months later. So a very awful situation. But again, that delayed care is really what we're as physical therapists trying to push for as direct access providers. We have the skill and training. So why not we just make the call and refer right away and then catch everyone up in their care team to make sure we're all on the same page. So methods, obviously, when running a study here at the University of Mary, we have to get IRB approval. We sent out the survey to the North Dakota Board of Physical Therapists. So every licensed physical therapist got an email in their inbox to fill out this survey. We also went on social media, advertised it in the American Physical Therapy Association North Dakota social media website. Additionally, we performed interviews on those interested, and so those who were interested in providing interview responses put their name and email down. We collected demographic data from the survey. We performed a binary logistics regression, some statistical analysis, and I'll walk through that a little bit later. And then we also performed a qualitative analysis. We ended up with a total of 154 participants in the state of North Dakota filling out the survey. And I'm going to maybe call on a couple physical therapists. If you had to guess, how many PTs do you think we have in North Dakota? I don't know this answer. Okay. Well, thank you. I appreciate it. So that response was really good. We were very pleased with that response. If there's only about 300 physical therapists in the state of North Dakota, we got a really good response rate from a lot of the physical therapists. 7 were excluded because they weren't a licensed physical therapist in North Dakota, or they didn't agree to complete it afterwards. So we ended up with a total of 147 participants in our study. These were our demographics, and I'm just going to highlight a couple things here. Majority of our demographic had the biological sex female. We had a good variety of years of experience, so you could see between 1 and 20 years of experience or greater than 20 years of experience. We had a good variety there. Over 3/4 of our participants had their doctorate degree. So again, some physical therapists out there still have their master's and bachelor's, or either had, the other is like a terminal degree, so like a doctorate of philosophy or doctorate of science or doctorate of education, but many of them had their doctorate of physical therapy. About 20% had some sort of post-professional training that we talked about previously. And you can see most of them were practicing in an orthopedic setting across the state. So that was our demographics. What we found was, at least from the survey, I'm gonna flip it around here. 25% of physical therapists that filled out our survey are directly referring for diagnostic imaging. I'm gonna be honest with you, when I first saw that number, I was like, that low? But if you look back at some of the studies that I just shared with you, that number is actually significantly higher than the 12% we saw in previous surveys. And so when we submitted this to the journal, we kind of were like, 75% are not referring. We were kind of a Debbie Downer, and they actually turned and reflected. They're like, this is probably the highest number we've seen since we've been collecting this data, that 25% North Dakota physical therapists in the survey are actually referring for imaging, so that was really good. 70% felt that the ability to refer for imaging would improve their ability to treat their patients. Now, this one really stood out to us. About 12% of participants who filled out the survey didn't know that they could. Well, that's a problem, right? Physical therapists, about 12% of our physical therapists in the state didn't know that they could do it. So I can only imagine what other medical providers are aware of, and then even just you as the public, right? If 12% of our PTs aren't able to know that they can refer for imaging, I can only imagine how much of the public is unaware that we can actually refer for imaging. 83% indicated they haven't, engaged in any formal continuing education, and then about 25% felt that they did not receive adequate training enrolled in TT school. However, many of these individuals had their bachelor's or master's degree. So that makes sense. They wouldn't have had this portion of the curriculum or content in the curriculum. This is a busy slide. I actually, after my Doctorate of Science, I love running stats now. Before, this actually scared me, but now like I get excited with this stuff, so this is great. But I'm going to dissect it for you here. So we had three dependent variables that we were looking at. I'm going to primarily focus on the top one. So you can see we had the question, are you referring for diagnostic imaging specific to plain film radiographs? Yes or no? And then we looked at some predictor variables, independent variables. You can see post-professional training. So either it was a yes or no question to all these. Either they had post-professional training, they had a doctorate degree, they were practicing in ortho sports. Urban part of North Dakota was the top 3 most populous areas. So we categorized that. If you practice in Bismarck, Fargo, and Grand Forks versus not practicing in those areas, and then practicing less than 5 years. So a couple things I want to highlight. What we found basically is that those with post-professional training in the state of North Dakota were 359% more likely to refer for plain film radiographs. Those who had a doctorate degree were 280% more likely to refer for plain film radiographs. And you can see the yellow is highlighted all the statistical findings. If you were practicing in the urban part of North Dakota, you were 200% more likely to refer for diagnostic imaging. So those were significant. Have you taken any Con Ed courses within the last 3 years? Again, that was highlighted. And then did you feel prepared to refer for diagnostic imaging from PT school? I just want to point this out. I thought this was great. If you had a doctorate degree, you were 2,232% more likely to feel that PT school prepared you adequately. So the good news is, I'm teaching that course. They feel prepared practicing and using this in the clinic. So that's what we found from our statistical analysis. Within our results for our survey, the top barriers that were identified as to why physical therapists are not doing this was logistics, or really capability of doing it. When you think logistics, what comes to mind? I'm going to kind of ask some questions here. Like, what do you think we mean by logistics, or they mean by logistics, as to maybe why they wouldn't refer for imaging? Yeah, right. We have a lot of clinics who are in rural state of North Dakota who don't have access to radiographs. Documentation in the world of healthcare, not knowing how to document that or actually make the referral. So that was the number one barrier. The other one was, number 2 and 3 are really related to each other. While it's within my jurisdictional state scope of practice, I'm not allowed to do it based in the setting that I work currently. We heard that a lot. So maybe it was only exclusively reserved for physician assistants or medical doctors or things like that. So there was some difficulties there. Overall cost of Con Ed, they felt that they haven't had Con Ed, or they couldn't identify areas to kind of catch them up to speed to feel more comfortable being able to do this. So this was the top barriers we identified with our North Dakota state physical therapists in the state. As far as our qualitative results, so again, qualitative, we identified themes. We identified 5 major themes after our interviews. So the interviews allowed us researchers to dive even further into the nuance why behind some of these things. And so I put some of the quotes that we identified from our physical therapists. So the first theme we identified is background in education. So many of I'll just kind of highlight a couple quotes here, but many felt that they needed extra continuing education to feel comfortable referring for imaging, which makes sense. Many of them thought it was awesome. It's a good step for our direction of physical therapists, but also healthcare in general. Number 2, logistics. So you can see the commonalities here within the survey and the interviews. Logistics, many of them felt, again, the biggest barrier was their EMR system. I just didn't know how to do it. Many felt they've been trying to work on doing it. It's been about a 2-year process. Someone said we especially had to work hard to convince leadership team to allow us to do it. So trying to advocate for themselves as physical therapists. And then again, just logistics. I didn't really know where to send this patient. Many of our participants worked in rural settings with communities less than 500 people. So they're like, well, how do I send someone? Where do I send someone? I don't readily have an MRI machine in my clinic, so where would I send this individual? Personal experiences, many had personal experiences as to why, and I want to highlight one here. We literally just had a patient that had a fall. So this physical therapist was a grad of ours, and she worked in an acute care setting. And she said, we literally just had a patient fall in the hospital and wasn't doing well. As physical therapists, we spend a lot of time with our patients, probably similar to occupational therapy, similar to speech-language pathology. We spend a lot of time with our patients, so we have a good understanding of exactly what's going on with our patients. Probably more so than, I would say, probably not as much as nursing, right? Nursing spends a lot of time with patients, but maybe second to that, we spend a lot of time with these patients. So this patient wasn't doing well. She had a radiograph when she was in the hospital, still wasn't doing well 2 weeks later, and the PT was trying to go up there, get them discharged, get them walking. We had to make the call to the physician 3 times to get another one, convince them, and she ended up having a fracture. And so a physical therapist was able to do that right away. We might have saved 3 weeks of time in the hospital. Benefits of diagnostic imaging, everyone, again, felt that this was a great avenue for, again, healthcare and physical therapists moving forward. And then lastly was awareness. Awareness by our own profession. Again, some said they had no idea that we as physical therapists could do this. Awareness of other medical providers. Many have shared quotes and statistics like, yeah, no one knows that we're able to do this, and when we share that with them, they kind of are surprised. And then lastly is just public awareness. Many aren't even aware that physical therapists can treat patients without seeing a doctor first. So clearly, and I'm going to go on my soapbox here, we as physical therapists have to maybe do a better job of advocating for our profession, and I'm guessing that's probably similar amongst many other healthcare professions. So what would we find out? Again, about 25% of survey participants are referring for diagnostic imaging. And again, if we compare that to a lot of the literature out there previously, this is a lot higher. So North Dakota, maybe we are hopefully setting an example for other states that are getting this practice. Similarities with Rundle et al. They felt that this is a great avenue for physical therapists to treat moving forward. Again, awareness is an issue. So just even starting here today, thank you for coming. I appreciate it, just allowing me to step on my soapbox for a bit and share what we do as physical therapists and the ability to not only refer for imaging, but just see the different areas that physical therapists can treat. And again, many barriers were identified. And so this study was the first, to my knowledge, in the world of physical therapy practice, identifying barriers as to why physical therapists aren't referring for imaging. So I'm hopeful that this study will be able to provide some background as to how can we address those barriers, because we have it within our scope of practice. It's gaining popularity in the United States, but how can we address some of these barriers to get us to practice the full scope of practice to ultimately help you as patients coming into our doors and working with you moving forward. So logistics. A good example of this is we had at CC's, we had to switch EMR systems and software to allow us to actually make that referral now. We didn't have access to plain film radiographs, and so we had to knock on doors and go talk to them and say, hey, can we work together here to, we'll send patients to your radiology department, and then again, everything is electronic now, then we would have access to those films. And so you could see that takes some time, that takes some work to work together. Identifying continuing education, background in education, again, and then just educating everyone on how this is going to be a benefit to the hospital, how it's going to be a benefit to the patient, how it's going to be beneficial to the just overall administration. It is noteworthy that, again, DPT is consistently ordering diagnostic imaging. So, again, because the physical therapy is a relatively new doctorate profession, it is noteworthy to show you that being a doctor of physical therapy does seem to have its advantages, and we're seeing that play out in these results in the study. And then rural healthcare, right? North Dakota is a rural state in the Midwest. One big thing and this isn't related to just only PT, but in healthcare, but we see a lot of population who have Medicare as their primary insurance. And unfortunately, Medicare really dictates what a lot of other healthcare provider or insurances do. And so currently right now, Medicare does not allow for physical therapists to directly refer for our diagnostic imaging, even though it is within our scope of practice. And so sometimes insurance dictates everything else. And so again, from an advocacy perspective, we have to work with Medicare and reform not only this, a lot of other things in relation to healthcare, but this would help a lot of our rural areas, because let's be honest, a lot of our rural areas have a lot of aging adults in that population, and so it's a restriction. If we could get imaging referrals, that might save them 2-3 hours of driving to Bismarck to then see another provider, to then get referred to another provider to get MRI, so it might help with that moving forward. So in conclusion, again, 1/4 of our PTs in North Dakota are referring for imaging, which is great. We're seeing that number much higher than what we see in other literature. There are barriers we need to address to help you as the public. And then having a doctor of physical therapy, specialized training, as well as practicing in ortho and sports and urban areas, we're more likely to refer for imaging. This is my son. Any questions? I hope you have questions. And so he likes to make this face. Any questions? Yes, thank you for that question. That's a fantastic question. So her question was, a lot of medical providers have some concerns that adding another profession to be able to order imaging might make a further problem moving forward, because there are stats to show that imaging is definitely overused in the United States and is contributing a lot to healthcare dollars being spent that aren't really necessary. So the concern is, are we going to overuse it, adding another person into the pile? So I didn't share those studies, but that's a fantastic question. There's studies to show that on average, physical therapists are referring for imaging less than 5% of the time, compared to, and I won't name other medical providers, but when we compare to other medical providers, this compared to the number of like up to 30 to 50% of the time. So PTs are using what we call evidence-based guidelines. Some examples of that include Canadian C-spine rules, Ottawa foot and ankle rules, Ottawa knee rules, some consensus evidence-based guidelines that help us to make a determination, do I need to refer or not? I think as physical therapists, we're probably leaning more at the pendulum of like, we don't really need imaging. And in fact, some studies have shown that, I bet if we did an MRI of everyone in the room, we got a low back pain MRI, or low back lumbar MRI, I bet almost half of us in the room, if not more, based on the stats right now, we would have probably some finding on an MRI. I'm sorry to share that with you. I hate to break that to you, but most of us would probably have a disc herniation, a disc bulge, degenerative disc disease, and many of us maybe have no pain whatsoever at all. And so the challenges, and some studies have found that for every MRI that's performed for low back pain or for lumbar pain, the number needed to harm is 2, basically meaning that for every 2 patients that receive a lumbar MRI, 1 will suffer mismanagement, meaning further injections, surgery, things like that. So that's the research out there, but I think as physical therapists, at least how we treat and how we educate this and using those evidence-based guidelines, we won't refer out unless it's going to drastically change our plan of care. And in those cases, what's going to change our plan of care? If they have a fracture, if they have cancer, infection, something bad. But beyond that, we don't really refer for imaging. And so that there's been studies to support that. And that's how we've gotten away with getting us added to the list, because we, compared to other medical providers, are way down here. So that's a great question. Thank you for asking that. Like awareness, you mean? Yeah. So her question was, how can we better educate our own profession, maybe and others, on what we do as physical therapists? That's a great question, Mary. Well, one, it's, I think, being able to do things like this, right? Share, as every medical profession, and maybe even other professions, share what you do and how that's impacted patients. I think a lot of times, share patient stories, right? Share examples, those things can help. Being a member of the American Physical Therapy Association, being a member of your actual organization, I think helps, because you get emails in your inbox of showing everything that is capable of your ability to do in your scope of practice. So I think that's important, being a member of your organization. But clearly, we have some work to do, and I think that question is really loaded. So we've identified we have some work to do. I think it's just trying to find ways to do that. And to be honest with you, that's a fantastic question that I feel like I'd have to dissect and think about. Yeah, so if you didn't hear, her question was, is there any correlation or relationship as to maybe where you received your training and whether you were using or not? Is that correct? We didn't dive that far, but what we did find is that, again, the majority of those participants, the 12% that were unaware that even them as physical therapists not being able to do it, they did not have their doctorate degree, which makes sense. They wouldn't have had that training in physical therapy school, and so therefore they were unaware. So now the great news is now that as physical therapists, we teach this content in the curriculum. Whether they want it or not, they have to come to class, they have to pass, they have to take an exam, they have to be competent and skillful in this content. So I think, that's going to help, right? They're going to have the evidence behind everything that I shared with you, how to use those effectively, what views to refer for, all that stuff. And so I think we will see that start to fluctuate right now with the curricular change of the doctor of physical therapy, having this content in the curriculum. We're going to see that hopefully a lot more people are aware of this because it was in their education. So there was a correlation of those who did not receive this in their DPT school, but fortunately now our accreditors say that we have to cover this, otherwise you won't get that. But that's a great question. Yeah. No, in fact, I would say it's almost the opposite. I feel like more than not, I am explaining to the patient, I don't think you need imaging. I don't think you need imaging. So a good example of this, I'm going to share an example with you. I had a patient come in who had low back pain. Low back pain by far is the number one thing we see as physical therapists in an outpatient setting. Low back pain came in. She had an x-ray from a couple years ago. So she brought the x-ray in, and most often they will, and they'll bring it in and be like, hey, I have the worst back. My doc said I have the worst back they've ever seen, worse than an 80-year-old, right? And this patient is 25 years old. And you're like, that's great. I'm guessing a lot of us would also have some findings on an MRI as well. And we'll get into the treatment plan. We'll try to get that going. And then, a couple weeks will go by, and she'll have the conversation with the patient. And she's like, I think I need an MRI. And I'm like, I don't think you need an MRI. Let's talk about that. And I'll share all the stats with her and be like, hey, did you know that if you get your MRI, you're more likely to have surgery? Do you want to have surgery? If you get an MRI, you're more likely to have this. In fact, I'm not concerned about red flags. I'm not concerned about fractures. Also, we live in a society for a quick fix. And just explaining that you've had low back pain for the last 10 years of your life. We're probably not going to get rid of it in 2 weeks, unfortunately. So I would say on the opposite, I've had more challenges of explaining to patients, I don't think you need imaging. Although there have been times, obviously, where I've said, again, emergent situations like, I think you need to go to the ER right now. But I haven't met my deductible. I understand that, but I think this is urgent enough. So it is both sides, but I would say most often I'm having a difficult time explaining to patients that they don't need imaging. Great question, thank you. Any other thoughts or questions? Okay, well, thank you for coming, everyone. I really appreciate it. Thank you.